Welcome.
Thank
It's a
you.
pleasure to have you.
Thank you so much. I'm glad to be here. It's an
Thank
honor.
you. Oh, that's so sweet. I remember, George, when you and I first met in arrangements for today, we realized very early on that we know some of the same practitioners, which is super exciting. It's a small world.
Yes.
I always
Yes.
say the like minds always find their way to each other. So not only with
Hmm.
our panel, but also with our audience. So it's so great to
Yeah.
feel like we're already kindred before we've even officially talked
Oh,
shop.
yeah. Well, these practitioners are only here because they're our colleagues. They're thinking about the same things we are.
Exactly. Exactly. And I can't wait for you to pour into them today as well. Just as a reminder for our practitioners who are here, please feel free to use the chat if you have any questions for George or anybody along the way today. That chat feature is your open live connection, and we welcome it. We'll get to all the questions that we can, and anything that hasn't been answered, we'll send directly to a speaker so that you can get them answered afterward.
Great.
George, I have a question for you. You've given us such good information about you that we added to our event site. Thank you. What's one thing that we don't know about you yet that you could share with us?
Oh, how interesting. I was born knowing how to do body work.
Hmm.
I have no idea how I had that skill. It might be because my mother was very physical. She was
Hmm.
Sicilian, had a lot of touch as a child. The attitude towards the body was very affirmative, and uh, that has changed everything about my life.
Oh, it's so good. Changed
Mm.
everything. I do feel like we have callings that we've been gifted and are meant to shepherd through this lifetime. And I also believe we have wishes on our heart that we're meant to expand while we're here. And when those
That's
two things
beautiful.
collide, woo, we are definitely on purpose. Yes, I love that for you. So, George, tell us what is the most prevalent for you right now. You've done clinical work. We talked about this when we met. You've done clinical work for a while now, as have I,
Yeah.
um, especially since you were born knowing. What's
Yeah.
what's current for you right now that's most pressing?
In terms of issues that I'm dealing with or ideas that I have in my practice and my work.
Yes.
Yeah. Well, I am in a phase of, let's say, accepting my elderhood. And as my career as a practitioner is changing and I'm working fewer hours with clients, the the sharing my gifts and information with like-minded practitioners is absolutely at the forefront of my consciousness. And
Mm,
I'm I've always, because of my bodywork background, I'm a chiropractor, but on my website you'll see that bodyworker comes first,
mhm.
because that is the primary way. My way of seeing the world is that of a bodyworker, and it's it really is my heart's desire to share every single thing I know with any body worker that wants that information. Of course, in an orthopedic context, I know that as a chiropractor, I have a lot of things to offer
Mhm.
because the trained body worker, in particular LMT, is the best practitioner to be working with all of the major musculoskeletal problems of our time. Better than chiropractors, better than PTs. Um, they're all good. I mean, we can't make generalizations about what a person's like based on their
Sure.
degree. But in general, I feel like LMTs spend more time. They have a more intimate relationship with the client because of the circumstances of the work, and they charge less per minute. And it's just clients are there because they want to be, because it's generally not covered by insurance. And that sets up the perfect situation to deal with uh, uh, injuries, most of which are chronic and based on something the person's doing, right? A
Yeah,
habit or, yeah, that can be changed.
I love that. So first of all, thank you for being such an incredible partner, right? One of the phrases that we use in my community is partnering for a pain-free world. Like we have a lot of depth in our lane and we're not the only ticket, right? So you're a shining example of that, George. Thank you.
The only competition that we all face in all of our professions is the ignorance of the American public as to how touch and movement therapies would radically alter their lives for the better. We are not in competition with each other, and I would like everybody to be sharing every single thing they know right out to the edge of their scope of practice.
Right out to the edge of their scope of practice. You said that when we met. I love that phrase. That to me means right to your capability and then another extra inch and a half. Like, don't
Right.
stop. Keep
Right.
growing. Keep growing. Don't become complacent. Is that
I
what it
love
means
that.
for you, George? What is,
Oh, yes,
yeah?
without
Okay.
question. It's beautiful. Right
Okay.
on.
Right on. Yeah, right. Okay, so for those who are admittedly still questioning what body work means and they're not a chiropractor yet, so they don't know what that training is because they weren't in it,
Right.
kind of have some assumptions about what that means. What do you mean when you say body worker versus chiropractic? Because you've really laid them out as being something completely separate, equally valid, but completely separate. What do you see as the distinctions and the comparative like support that they can
Yeah.
each offer?
Well, first of all, I inherited that distinction between chiropractor and body worker. I don't experience it in my work. I'm never one or the other.
Mm,
I come to each situation, every treatment is different. I'm lucky to have a lot of directions that I can go in, and I have a suspicion that everybody that's decided to come to your seminar is of the same ilk.
mm,
People who want different perspectives and who bring them to bear in a given situation because nothing's ever the same. No client is the same week to week. No situation is the same. So that's the first thing I would say. But I would say in general that massage therapists tend to err on the side of working muscles and muscles only, and to think of the skeleton as something you press a muscle against, almost like a table that a seamstress would work on. But
mm,
in fact, of course, the joints are with us all the time. Muscles move bones at joints, and that's
mhm,
when directed to by the nervous system. So, in general, PTs tend to focus too much on exercise and strengthening.
mhm.
Chiropractors tend to spend too much time on mobilizing joints, and body workers
Oh, oh,
on massage. I'm sorry, on of course on massage, but on the muscles.
muscles.
And if
Okay.
we can integrate our approach so that we're always thinking about all three things,
Mhm.
that's when it really takes off. And certainly in an orthopedic context, one needs to consider all those things.
Absolutely. In an orthopedic context. So I hear some practitioners becoming a little confused, like, am I supposed to do it all? What if I don't know it all? How can I do it all? If you are working orthopedically, then you get to focus on all three of those. If you are not working orthopedically, then your lane is absolutely valid. George, do you have a
I
snowstorm
lost
where
you
you
for a
are?
minute.
Yeah. Do you have a
Yeah,
snowstorm where you are? I know that we have
not
similar
right this
weather.
second, but for some
Okay.
reason we lost each other. I'm not sure why. But
Okay.
yeah, just you could just crystallize what you just said. I'm ready to go.
I was reflecting on what I've been steering our audience, attendees, practitioners towards, which is, do I do all of it in pile drive or do I just put blinders on and not focus on anything else? How do I know? And so what I heard you say was the distinction of orthopedic work means you get to have clarity on all of those moving parts. If you're not doing orthopedic work, then your lane is very valid. We said that at
Oh,
the
everyone has a choice. I mean, a relaxation massage, as it's called, of course,
Mhm.
nothing's ever just one thing. But if you
Right.
want to think of it as relaxation massage, everybody here knows that's unbelievably great. I mean, it's
Mhm.
fantastic. I'm not working in that lane though, because what I'm interested in is movement.
Mm,
Ultimately, it's improving people's movement is the central image of my work. And that requires me to release muscles, to work with the nervous system, to do movement training of some kind, and of course, to mobilize joints. So, and I think what orthopedic is a big word, right? And it starts to
yes.
make people think in a sciency way, and then people can start to get nervous about that whole thing. But really, orthopedic conditions are the same as any other thing that you're dealing with. It does might require special training, and that's what you're offering to your colleagues here. But and it certainly requires that special training, but it isn't like a whole different thing. And I think diagnosis, the idea that massage therapists can't diagnose, is completely absurd to me. What is assessment? It's diagnosis. What is a diagnosis? It's a hunch based on which you're going to try something. Anybody who tells you diagnosis is something else is drinking the Kool-Aid. And there's no reason why I and medical professionals should have some like special, like put on a special hat and we get to say what the diagnosis is. You're already doing it. You can learn to do it better, and so can I.
Love that. Love the real talk, George. I bring it, right? Bring it. Yeah, the phrase that worked for me early on, and I share this with my practitioners, is diagnose insofar as what you can treat. So I'm not going to say, oh, it sounds like this
Nice.
thing I saw on social media. I'm going to say, it sounds like this thing I have addressed several times. Let me look into that further for you and then treat appropriately.
Right. And if you have a suspicion that they have cancer, then oh, somebody likes my thinking. Those are the words I
Very,
love to hear.
yeah,
But
he's one
anyway,
of our accelerators.
um, if you think they suspect they have cancer, that's not something you can treat. And so you find a way to say it in a non-threatening way. Like, I think this is also a situation that you should have evaluated by your doctor. I just feel like there's might be something going on here that's beyond what I can do. You don't have to use the C word because you don't know and you don't want to upset them. But it's not that you might not notice something that's out of your sphere, but you make sure that you send the person where they need to go.
Absolutely. And I think that's really important, as you were talking about with massage therapists. It's a very thorough, connected relationship, full body massage, hands on the whole time. And I remember back in that day, feeling something on one of my very favorite clients' scalps, which I
Right.
didn't usually do scalp at the time, but this was not, it was bigger than the size of the pea. It was not soft like a grape. I was like, this is
Right.
it's really tempting when we find something to say, "Oh my gosh, I think this is a thing." And then our nervousness, because of our lack of clarity, creates
Right.
nervousness in the person we're in service to, where instead you just get to notice and then note it and then state what you noted.
Right.
I would like you to have this looked at. I don't know what it is.
Right.
Period at the
The
end.
I don't know part is so helpful for the client
Mhm.
because it leaves them room to not freak out and get on Google.
Oh, right. And that was, you're right, George. That was before the days of Google. We're
Hmm.
dating ourselves here, but that's fine. It was before the days of Google. You are right. That instant information on self-diagnoses has created a whole swirl of nervousness in the people that we're in service to. And then I think practitioners feel like they needed to get a leg up on that. And so then they needed to Google faster. And now everybody's in a frantic fast about something that just needs to just be noted and it's not in your lane.
Yeah, it starts being like the stock market, which is just a whole bunch of people running one way and then turning around like birds and running another way. But it's not actually furthering health or knowledge.
Exactly, exactly. So you are teaching as well, and I'd love to hear from you. What is the common denominator of a frequent gap that you see in the practitioners that you're teaching? And I ask every one of our panelists this, and the reasoning isn't to out practitioners who don't know, it's to fill the gap quicker so that,
Yes.
this is a common thing that we're all showing up with. Let's just fill the gap, and then we can move on with the other thing you were going to teach. What is that common gap?
Well, I think it's the thirst to touch and move with soft tissue.
Mm,
And it's also, in some practitioners, I bet it doesn't apply to too many people here, but in some practitioners to view everything as muscular.
mhm,
90%, maybe 95% of what massage therapists work on is fascia. Once
mhm,
the fascia is released, the muscles usually will just follow suit. And I think that's that kind of golden moment that some massage people experience, like in the last 10 minutes, something lets go. What let go was the fascia, and their nervous system follows.
mm,
So I would say like being able to identify different levels of tissue, because once you can do that, first of all, you know which way you have to go, and second of all, you can uh, your perception of the self expands exponentially because of course we're dealing
mhm.
with spiritual. I mean, if you don't get freaked out about the word
Yeah,
spiritual,
no, we're a Venn
spiritual,
diagram.
emotional, energetic. We're dealing with so many overlapping realities, and
Mhm,
we don't need to kind of like fall back into what we know uh most, or into what we think our job is, but to really
mhm,
think of our job as working with the whole self always.
mhm.
It's always there, and so is your whole self.
Yes, absolutely. We call that the Venn diagram of the whole being in my training. That's what we're
Ooh,
doing, right?
delicious.
Like you get to be an expert at the physical part. Don't become an armchair psychologist, but you get to know that the whole being is bringing their psychology with them as well as you called it, their spirit too, for
And
sure.
whether you are defining what you're doing as psychological or not, you are impacting their psychology. Your own psychology is coming into play. It's all present.
Hmm.
Again, like you said, you stay with what you actually are, let's say, allowed by the government to do or by the board or something like that. But you have to know that all those things are happening so that you can respond in your way to whatever level of information is coming into you.
Right, exactly. And yeah, I mean, I hear a little bit of like by the board that you're allowed to, and also that you're trained to, right? We don't need a
Sure.
bunch of renegades running around making decisions for people if we don't have a lot of basis for that information. You need to be
Right.
trained and skilled in the thing that you're assessing and asserting. And
100%. But having said that, let's all just admit for a second that we know a whole bunch of things that we don't know how we know, that we know a whole bunch of things that no one ever trained us to do, that we
Mhm,
know things that we don't know how we know them. And
mhm.
we're allowed to use that information, even though we don't want to start stepping out into something where we're really not going to know where we are or have any kind of, what's the word, landmarks or parameters to be safe.
Absolutely. And you're bringing up a really good point, Frank. George, I just saw Frank's
Yeah,
clock
so did
on the screen.
I.
So
Whenever Frank appears, he throws a long shadow.
yeah, but you're bringing up a really good point because we do know things. And yes, Gary is saying the intuitive touch. We know things,
Right,
and also you need to know them in your bones, not just have hunches of things. It needs to be the same hunch keeps following you like a shadow. And that requires reverence. I remember that's exactly what happened for me when I learned my method. It wasn't taught to me. It came in and I was so like, how do I know this over and over and over and over and over and over for like a decade before I
right.
called it a method? And I didn't even do that. A coach said, you need to call this thing something. So I want to be really thoughtful that it's an integrated depth of knowing what you know. It's not just, I call it like rock skipping over the pond. Like we don't want to do that kind of work. We want to have a depth
Hmm.
of what we're doing, an immersion in our knowledge and skill.
I love it.
Hmm.
And I guess, the things that we start to perceive over and over again become the things that we study,
Hmm.
right? So we can go from those kind of awarenesses, we can then proceed into educating ourselves about whatever it is we've perceived, and then we can expand our island of information and approach.
Absolutely. And I like this expanded. Every time you speak, I feel wider and brighter and like broader. I felt like that when we met one on one, and I'm certainly feeling it now.
Me
And
too.
to ground that for us, you mentioned earlier, not just muscles, not just fascia, not just joints. And one of the traps that I see practitioners fall into is they do, and it's all the time, always, forever. It's always this thing. Nothing's always. It's not
Okay.
everything is always, right? So we want to
Right.
like be really thoughtful about absolutes. And if you're diving into fascia, dive in. Get to know it. Don't hop skip. If you're diving into joint function, dive in and then integrate them together. Don't just
That's really interesting. Yeah. Makes
absolutes.
sense.
So
Yeah.
great. So, George, tell us what's next for you. You said you're in transition, you're doing less clinical work and doing more of something different. Do you want to share with us what that is? Is it come to fruition for you yet that you can bring it?
It really is just a shift in focus towards the things that I've already been doing, which is to
Hmm.
educate as many people and in particular body workers, but also, I teach movement classes and posture classes, which by the way are available for LMT credit. But I teach those kind of things. It's already something I've been doing, but I'm turning my focus more to that and trying as much as I can to be of service and to pass on what I have figured out and to
Mm.
just get people excited about our profession.
Hmm.
Um, because, as I said, the American public is so anti-Semitic, I would say, you know. Interestingly, they're also anti-intellectual, so it's like both the body and the mind are getting short shrift in our country. But the felt body is the felt body in movement is really my focus, and I want to just help as many people as I can to work with that entity.
Amazing. So I want you to talk to us about what the focal point is for you in the movement work that you're teaching. And I want to also ask you, what do you think is our responsibility for the public? You've mentioned it a few times, and we're definitely,
Yeah.
we're responsible for them, right? So Can you touch on that?
We need to talk to people. We need to, first of all, we need to learn to talk about what we do, which a lot of massage therapists don't do. Massage therapists in general, probably not the people on this call, but the massage therapists in general tend to be people who are kinesthetic learners. They're not particularly verbal, and that's why they are in the profession they're in. But we need to learn to have vocabulary for what we're perceiving because
Mhm.
we then need to turn to the public. And when we're talking about what we do, to expand the scope of what we talk about, both in terms of the benefit to the potential patient, and in terms of the scope of what we can do uh, for people. And in particular, like here we are in an orthopedic context, we need to know how to talk about that
Yes.
because if we can't, then we're only going to capture the people that trickle in based on referrals. And that's obviously the main way that I get clients. And I'm sure it's the main way that you get clients.
Mhm.
But somebody you meet at a party, if you can actually give them a little bit of a sense of what it would be like to truly feel their bodies, to feel the earth, to feel movement flowing through all parts of their body, I think we can make a huge change in our culture. And when
Oh,
that happens, I don't think that somebody that feels their body fully is going to shoot up a room of their fellow students. The people that get touched the least in our culture are old people and teenage boys.
mm,
We need to keep moving forward in that way. We need to change our culture profoundly. And it's not just by getting people to have a massage, it's so much more than that. But we
mm,
are right in the center of that struggle.
mm. I love what you're saying. It's messaging. We have an entire 3-month module on this exact thing, George. So thank you.
Really?
Yeah, I know my mastery practitioners are probably like, I feel like Gina said this before. That you said it right. We're kinesthetic and connected by nature, and that's amazing and important. And we need to have verbal skills with that. We need to be able to message what we do. And you said the magic word, benefits. Benefits, not features. It's about them and for them, not about you, right? So it's
Right.
how
Oh,
do
that's so
people.
nice that I see what you mean. Right. So that
Mhm.
the language isn't like I do this and I do that, but it's like, here's what you could expect. Like you can
Yes.
have X. You
Mhm.
really can, and I can help.
Yes, that. Yeah. So I love that you say that that's our gap that we get to fill because I feel like we're doing that. So great. We all get to do that. We get to fill that gap for the general public because they're also getting their information in droves from strangers on the internet. Should be you.
Strangers who often know next to nothing.
Right. It should be you, the person in front of them. Right.
And there's no shame in it if you don't know how to talk about your work.
Right.
But it does require training. I'm thrilled that you're spending a really good amount of time on that because it doesn't happen right away. It doesn't
No.
happen overnight, finding that vocabulary.
Yeah.
I mean, part of the reason I teach is because that kind of stuff came relatively naturally to me because I'm super verbal in case you haven't noticed. Um, but I have so much compassion with people that aren't oriented that way, partly because they're so oriented towards helping people with their hands,
Right.
which is that's what you absolutely need. And if you don't have that, you don't have anything. But this extra layer really does take time, and you're certainly a person that can help people with that.
Oh, so good. And what about the movement part, George? What are you focused on for movement? From
Well,
chiropractic to manual to movement. Yeah, tell us.
yeah. So increased ease, efficiency, grace, and also joy of movement. Really getting people to feel that again so that exercise is not drudgery
Mm-hmm.
and thinking about the alignment through, it's not just the alignment, it's also movement potential in general, but thinking about the alignment in a way that's sort of vivid and metaphoric and not just analytical, structural, I have a hip, stuff like that. When people say, I have a hip, well, yeah, you do. But I mean, not thinking in terms of the specific parts of the body as if the body were made from an erector set, if they even have those anymore, or a Lego, but it's really like a living, breathing entity that's firing on all circuits and uh, all the different things that you feel when you can move. Like movement itself is the way we know the world,
Mm-hmm.
you know? And just to try and offer that to people in bite-sized portions that they can take in at that moment and feel, and then from there help them to build something where they can go off and do it themselves, and they won't necessarily be like trudging on a treadmill while watching, reruns of Ellen or something.
That's so great. So it sounds like you start with practitioners learning on their own first, and then you teach them how to also share that with their client base. Is that right?
Yes. And
Spectacular.
it's somewhat easier for massage therapists in general because a lot of times we can feel our bodies more than other people can because we spend all this time doing a movement activity where
Mhm.
we're touching people and feeling them. So we start with perhaps more kinesthesia, which
Mm,
is, but you don't have kinesthesia, then it's impossible to change your physical self.
yeah.
So working from there,
Mm.
and the whole time that I'm teaching, I'm giving language to what I'm doing, whether it's anatomical language or metaphorical language or whatever. So that also helps the therapist to know how to start using that with clients.
That is so interesting that you said it would be easier for massage therapists because I train both manual and movement practitioners, and usually
Me
manual
too.
practitioners say, "Oh, but I'm not a movement person. I don't do yoga. I don't do." But you're saying it's actually the opposite. They have an easier in on the movement portion of the training.
Yeah. I mean,
So
of
good.
course depends so much on the individual person, but what I would say
Sure.
is the skill that a massage therapist brings to bear on a movement activity is the skill of being able to sense yourself, to feel
Right.
yourself. And then if skill building, everybody has a skill they need to build, but the skill
Mhm.
building can follow, and that could be challenging for someone. But if you can feel your body, you can ground your body. And um, I think of posture more or less as a gravity strategy.
Gravity strategy, as in opposing gravity?
Yeah, but also working with it. I mean, our bones developed so that we can work with gravity. We're not actually fighting gravity. If we didn't have gravity, we wouldn't be able to move at all. Because in order to lift my arm, I have to push down somewhere. So I'm pushing down into the chair. I'm using gravity. Think about it.
So
Nobody
good.
cheerleads in outer space. At least I've never seen it. So because there's nothing to push off of, right? You get your pom-poms and everything, but you're still stuck in a fetal position because of your fascial envelope just floating around. You have nothing to push against, so you have nothing, you can't move.
Oh,
So
that's
gravity as a partner, but also, in order to lift up, there is some sense in which you have to fight gravity, and that involves muscle, then we get into the whole dog and pony show.
George, I might start saying that gravity as a partner because I'm big on partnering and we oppose gravity with with a big piece of the Shatz method. So I like this, the partnering part. I might be quoting you in classes to come. So thank you for that.
Quote me, and pretend you made it up yourself.
No, I would never steal. You're genius.
Well, nobody, no, yeah, they don't need to know. You just, I just want people to take everything that I have. I mean, I love renown. I love people telling me I'm awesome. Who doesn't? But the main thing here is like, let's get this information out. I'm sure you feel the same way. It's like,
Oh
let's get
yeah,
this information out. Let's have everybody start using it and don't feel like you have to attribute because everything came from somewhere else.
for sure, for sure. And I feel you. How faster could I get this out? Like that feels prevalent every day. So I share that with you so
Yes.
much. When two minds
Yeah.
are together, we make more progress. Chantel just dropped in our chat the gift that you offered our attendees. Thank you so much for your generosity, George.
Oh,
Your
yeah.
email address is there. The links for the email address and the details about your attendee gift is there. I'm certain you'll be hearing from so many people in our attendee audience today and
Great.
those who watch on the replay. Lots of folks are in clinical spaces right now, so they'll come back to watch the replay
Beautiful.
before the end of
Well,
the
feel
day.
free. Anybody that's on this call or is going to watch it as a recording, feel free to contact me if you have questions about quote orthopedic issues or really anything else. I enjoy talking and writing back and forth. So feel free if you have a question, let me know.
Oh, thank you, George, so much. I will definitely also keep the phone lines open so that we can stay in touch as well. I appreciate you deeply. Thank you for being here
You
with
too.
me.
Thank you so much, Gina.